Good afternoon, everybody. Again, we're here today to give an update on where COVID-19 is in Eau Claire County and to share the information that we have with the community. It's been important to us that people are updated and are able to have information every day during the week so that they can know what is happening. We've had a lot of changes again, and I know that changes are not easy. Uncertainty isn't easy. Disruption to people's lives isn't easy. Our families, our children, our workplaces, all are getting impacted by this, and that's difficult. And we really want to make sure that people reach out to one another and really support each other. So we also know that this has been days in the last couple of days where we've gotten information about additional cases. In Wisconsin, there are now deaths. That's hard. We unfortunately know it likely is going to be more difficult in the days ahead because we'll have more cases and more deaths. That's a challenge, and again, we need to support each other. I do want to recognize, though, that we have people that are working very hard on the front lines of responding to this, really across the spectrum of responders. Obviously, our healthcare workers, the public health partners, the people in government, the people across all sectors are really making a big difference in how we come forward with issues. Again, I want to reiterate that everyone needs to take this seriously. This is not a disease that will exempt anybody. So it's something that all will have to pay attention to. It doesn't matter your age or your gender or where you live. We all will have to pay attention and take it seriously. In order to flatten the curve, which we'll talk about a little bit more, it really takes all of us. It's not just some people that have to do that, but we all do. Today, we want to share with everybody that we have now 3 confirmed cases in Eau Claire County, 2 new cases as of today. One of those new cases is travel-related and has been quarantined since travel. The other person we're learning more about, we've heard about that case since the website even got updated, so you may notice on the website that it does say 2. The state website says that, but we do actually have 3 cases, and we got that right before I came upstairs, and that 3rd case we are working on as well. In Wisconsin, there are 206 positive cases today and 3 deaths. Very, very difficult, obviously, and all of us are thinking about those individuals and families. And unfortunately, we will see more. We know that with this course of disease that it will happen. There are over 3,400 negative tests for COVID-19 in Wisconsin. In Eau Claire, again, as I said yesterday, we have had more than 100 tests run, and again, the 3 positive cases. The governor gave us all an update today at 1:30, and we have a couple of points to make from that. He is strongly urging people to stay home. He is hoping that we all will take those common sense measures to not get people sick. So staying home, doing the things that we can do to not have that circle of spread happen. We have many people that we need to not stay home, and the more of us that can do that, the better. Those people that we need working are those that are responding to this incident, those that are in essential functions across our systems. We need to still have those people able to work, so others need to limit their time in contact with others. The governor is also urging everybody to vote, and I would say that that is an important step for people in Wisconsin, including in Eau Claire. And the state is working on broad systems to support food safety and security as well. A new order was released a couple of minutes ago by the governor. That is order number 8 related to this emergency. It is clarifying some of the mass gathering orders that were sent out earlier in the week. And those clarifications do include some additional restrictions, specifically places like hair salons, tattoo parlors, day spas, and tanning facilities, for example, are now places that are no longer able to stay open as of 5 o'clock today. The new order is on our website and certainly can be accessed for more information. If people would like, we can certainly talk about some of those details later. We also are putting together with our communication group a new public awareness campaign that you'll see coming out that is called Keep Calm and Stop the Spread. We really are hoping by using that, those simple messages, that people will post those signs around and will use that as a way to remind people that this is serious and is something that we want everyone to pay attention to. Again, we need all of your help to preserve and protect the health of people in this community. That Keep Calm and Stop the Spread campaign is really saying all of us, adults, teens, families, everybody has a role to play. All of us can make a difference and still have fun and enjoy our families, but do things that will protect the broader community. We also want to make sure that we each do our part to prevent the spread of disease, prepare for our families and our businesses, and also not panic. It has been a difficult time. Many people struggle when stress is high, and I think we need to look out for one another and reach out to one another. That reaching out might be via the phone, reaching out at a distance, that 6-foot distance, but don't stop connecting with those that you love and those that may need a little extra boost. We've talked a lot about flattening the curve. Flattening the curve, again, is really paying attention to minimizing the spread of disease now that we have it in our community. We do that so that we have fewer people showing up very ill in our healthcare system. So very frankly, we are trying to reduce spread out when people have to arrive at the healthcare system and utilize those resources. You can all help us because we need to conserve the resources of our hospitals, our clinics, our physicians, our nurses. We need to help them be able to have the time and space to do their work. Today we have a few of our governmental partners from the area here. We've been working very closely with partners, and we've said that over and over and over again, and that makes an enormous difference. Today we have a couple of people to give local updates from their organizational perspective, to share with you some things that are happening in the city of Eau Claire, in the county of Eau Claire, and at UW Eau Claire. So we'll first start with Eau Claire County, and if you could come forward, Catherine, and we'll just go through one by one, the county, the city, and then UW Eau Claire. And then following that, I will share some final concluding thoughts, and then we'll have questions for any of us after that.
Thank you for all the work that you're doing in public health as well. Today, Eau Claire County is closing its facility to all walk-in traffic, but we are still open for business for those who call or arrange an appointment online via email. The court function is still operating, and our facility, our government center, will have the doors on Oxford Avenue open for access to the courts and for those with the prearranged appointment. Of course, we do continue to be here to provide essential services to very vulnerable populations. And so I'm going to go over some of those services. And you can access all of this information on our website. If you do not have access to a website or a reliable source to actually look that up, we do have a number that you can call, a general number, and they will direct your inquiry to the department that it needs to go to, and that number is 715-271-7970. So again, essential business functions continue. The Aging and Disability Resource Center is continuing the Meals on Wheels program, and you can still sign up for that service. The Child Support Agency is continuing, and their workers can be accessed via phone or email. The Community Service Program recognizes the importance of continuing to deliver essential services, and so they have identified a strategy for individuals who are enrolled in that program to continue their efforts. There is significant detail of that program on our website, or you can call for more information. The county clerk will continue to offer marriage licenses and voting services. Again, call the office for either of those services. The courts will continue to function for necessary services, and we'll keep you posted on updates to their court calendar or changes to their schedule as they occur. District Attorney and Victim Witness, in consultation with the courts, will also continue to function, and they have numbers posted as well if you need to reach those offices. Our Human Services is continuing to meet the requirements for safety in the community in the areas of Child Protective Services, Juvenile Intake, Crisis Services, Adult Protective Services, and Economic Support. The agency is answering phone calls, and the department is responding to emails during normal business hours. You can go to the Human Services webpage for more information. There is also a general number posted if you are uncertain of where to go for the service you need. Abuse and neglect is also identified there if you have a concern that you would like to report. Our jail and police function also continues, as does our patrol in the Sheriff's Department. In planning and development, you can continue to access the necessary permits and licenses that you need online or via phone. The same holds true for the Register of Deeds for any vital records or property records. Our treasurer as well is still able to take property tax payments and also issue the necessary receipts for those who need them. And our Veteran Services also is still servicing veterans through the phone and through email and other electronic resources. And all of this information will be posted on our website. We will keep you updated on any changes in service, and we look forward to continuing to serve you as we work through this pandemic. Thank you.
Thank you, Liska and Catherine, and for this opportunity to talk a little bit about the City of Eau Claire and the services at the City of Eau Claire. These, of course, are some very challenging times, and everyone, of course, as Ms. Giese pointed out, needs to do their part. Together, we need to work to get through this. City services to date have been able to continue without interruption. We work very closely with the health department and following their guidelines. And we're also working very closely with the county and our other cities to have a coordinated and collaborative approach to how we provide the city services. And all of this is happening, of course, because we've got dedicated employees that are supporting an incident command structure within the health department to be able to continue to provide the services to the community. As has been said so many times before, this is an incredibly rapidly changing situation. I am meeting with all of our department heads electronically every day to have updates on the services that we have, and we've been implementing our contingency plans. Unlike many other businesses or operations, a city by its nature and much of it is at work, we have many employees that still have to report to work. They're frontline employees, very much like and in line with healthcare workers. We're doing this by doing backfilling and cross-training and working with partners like our tech school, and we're working diligently to keep our employees safe by taking precautions to clean their clothes, the cars, and the equipment. A little bit about each of the types of service that, of course, must continue at the local level, even in times of crisis and disaster. Police, fire, our 911 center are the obvious local services that we are continuing to keep operating. But other very important and essential services people perhaps take for granted, like water or the sewer, I would like to point out very clearly that the water system is safe, the water system is reliable, and the water will continue to become into your homes in a very safe and effective manner. Likewise, we have backfilled and trained and automated services that allow for the sewer services to continue. Other essential services, though, are also the street department and our ability to clear the streets if we have a big snowstorm or be able to take care of any floodwaters that we might still have. And services that people might not also consider important, but we consider very important, things like transit. And today we implemented some new procedures within the Transit Authority for our bus service for those individuals that need to get to a particular important service and they can't do it any other way. We are blocking off the front portion of the buses to protect the drivers, and the passengers board through the back of the bus, and we are waiving the fares on our bus service at this time. As was mentioned by Governor Evers earlier in his press conference, elections are continuing. And for several weeks now, we have been working diligently to figure out how we can safely and effectively still conduct an election. Key to that is absentee voting. The primary election is April 7th, and if you're a registered voter, you're highly encouraged to go to myvote.wisconsin.gov and request an absentee ballot. We are processing a record number of absentee ballots and are prepared to continue to be able to process those absentee ballots. It's important to know that the deadline for an absentee ballot is April 2nd. It has to be returned to the clerk's office by April 2nd. If you're not registered to vote and you still want to be able to do the absentee voting, that registration has to happen in person, and we have set up procedures at City Hall so that people can still register to vote in person. City Hall is not just a building. City Hall is a set of services that coordinate and provide continuity to our life in a local government. And so although we have not restricted walk-in traffic at this time, we likely will in the future. We do not have have many of our employees that are now working online, and you would be encouraged to go to the website because almost all of the services that you would have been able to do in person at City Hall are now online and available. Please visit the City of Eau Claire website to find those services and to be able to access them. The big message with all of this, and as was pointed out by Ms. Giese, is there are many, many people that are still working and have to work in order to be able to take care of everybody else. It's absolutely imperative that what you can do as a citizen is stay home, because by doing that, you're helping those that are helping you. The best way to help those that will continue to help you is to stay at home. Finally, this is a big challenge, and there are many generations that have gone before us and faced great unknowns like this. But I feel really confident that we have the creativity, the ingenuity, and the heart to find our way through this. We have dedicated public employees that will not only continue to provide the service, but are going to go above and beyond to figure out how we can continue to provide essential services to our community. But we don't do this alone, we do this together. And it's very important that we reach out to each other, that we find ways to support local business, that you reach out to offer support to each other, perhaps help with some babysitting, check on your elderly neighbors, make sure that they have their basic foods and needs met. And it was mentioned earlier, be calm and stop the spread, because together we will work together and we will get through this.
I'd like to start by thanking the partners who have stepped up here before. It has been an absolute privilege to have such great working relationships with the city and the county and other governmental officials that are making this crisis a lot more workable for the people of Eau Claire. So earlier this afternoon, I had learned that one of our study abroad students had become the first Blue Gold to have contracted COVID-19 virus. The student was studying abroad when the virus was contracted, returned home, and did not return to campus. UW Eau Claire Director of Risk Management and Safety, Tim Bainham, spoke to the student, who was self-isolating and doing well at home with his family. Tim also spoke to 2 other Blue Golds who may have had contact with a student during their study abroad program, and both are doing well and self-isolating at their home with their families. The student who tested positive and the fellow student who studied abroad with him did not return to Eau Claire County following their return to the United States, and they did not come into contact with any individuals on the Eau Claire campus. I want to reiterate the importance of social distancing and hygiene as we navigate what has become a very challenging time for all of us. We must take our necessary precautions to keep ourselves and our families safe. Earlier today, I made announcements on a number of decisions made at the university. We were the last UW school, I think, to make this decision, but we've joined our sister institutions in determining that the rest of spring semester will all be online or through alternate delivery. There will be no face-to-face classes for the remainder of spring semester. We are making a firm commitment to all students who had planned to graduate this semester. If you do your part, we will do our part, and we will make sure you have the opportunity to graduate on time. Speaking of graduation, we also made the decision to postpone our May commencement until we can hold it safely. These graduates deserve the time to celebrate their time in the sun. They deserve the opportunity for friends and families alike to come together to celebrate their great achievement of graduating from UW-Eau Claire. But we will hold it when it is safe to do so. We hope that that can be done yet this summer, but we will keep people noticed at any changes. Students may check the commencement website at UW-Eau Claire in order to get more frequent updates. We are also planning to move all of our summer coursework online and through alternate delivery as well. The vast majority of our courses are already done that way in the summer, but we've made that decision as well. With the announcement of no additional face-to-face classes, we are encouraging students to consider moving out of the residence halls. Students who would prefer to remain in university housing will be able to do so, but they do need to be in contact with our housing office. Those students who will be staying on campus will likely be asked to move, however, into different housing. Our goal is to consolidate any remaining students in 1 or 2 residence halls in order to reduce our maintenance and staffing costs. For those who are choosing to move out, we would ask that they try to move out no later than Saturday, April 4th, again, if at all possible. We know that this crisis has created a lot of difficulties, made it difficult to travel, and if you are in a situation where that can't be done, please contact housing to make arrangements, and we will make sure that we can figure out something to meet your needs as well. We also know that families and students are under a great deal of financial stress due to businesses closing for short periods of time or limiting hours, both for our students and many of the parents of our students. We will be processing pro rata refunds for housing and dining contracts at the university. It will take us some time to get them processed because it's a lot of handwork. We anticipate getting those refunds to students and parents by the end of the semester. We're also making available to faculty, staff, and students parking refunds for the balance of the academic year. We're truly taking an unprecedented move, unheard of at the university, in that we will not be patrolling the R, S, F, and B parking lots at the university. The G spaces, the guaranteed spaces, still will be patrolled, and G permit holders will have the opportunity to keep their permit or turn it in for a prorated refund. Finally, I'd like to thank our faculty and staff for stepping up in an unprecedented way to deal with the great stresses involved with moving curriculum online and providing services online. These faculty and staff are dealing with stresses of their own. Many of them have children at home, some have family members with underlying health concerns, and this has been a stressful time for everyone. And yet I have dozens and dozens and dozens of examples where faculty and staff have gone way above and beyond to make sure students have the educational resources, the services necessary to successfully complete this semester and stay on track towards graduation. I also want to thank area healthcare providers who will be caring for our friends and neighbors. We are truly blessed to have some of the greatest healthcare in the country, and I have every confidence that the Chippewa Valley will work together to minimize the negative health, economic, and social impacts of the COVID-19 virus. Thank you.
So again, this is a partnership. As you hear from the partners that shared with you today, we are working together. This is a community, this is a county that works together, and we have to do that. We more importantly have to do that now when we're under such difficult times. So we are very fortunate to have that here in this community. I would like to remind people that up-to-date information is at the Health Department website about this situation. Again, that's coronavirus.echdepartment.org. If people have specific questions that can't be answered at that website and really need to talk to someone, again, the phone number that we've set up for coronavirus in this community is 715-839-4725. Over the weekend, we will not be holding our 3:30 press event, but if there is a significant change that we hear at a state level or something significant that happens, we will let the media know that. Do know that we will be working all weekend, though. This disease does not stop, and we will continue to be doing the work we need to do to prevent spread of the disease in this community, and that's the work we do in public health and with all of our community partners. I'd like to reiterate that we have 3 positive cases for COVID-19 now in Eau Claire County. I would also like to clarify that Chancellor Schmidt did mention an individual at UW Eau Claire. That is not one of the people that is an Eau Claire resident. So just to clarify that for the community. Again, we have 3 positive COVID-19 cases in Eau Claire County. We're available to answer questions at this point, and again, we'll reconvene next week, Monday, to share with you again. Go ahead.
Are any of these 3 cases connected? Do they have contact with each other, or are these 3 unrelated cases that these people have never been in contact with each other?
Mm-hmm. So the question was, are these 3 unrelated cases, or do they have contact with each other? At this point in time, I don't have that information, and we certainly would only be sharing generally if we thought there was community transmission versus whether it was transmission from another source. Again, as I said, one of the 2 cases we know is travel associated, and the other we just got before I walked upstairs, so we're doing that investigation. Our job in public health is to really to respect people's privacy, and we will continue to do that. We will share really that they are Eau Claire County residents and how many cases we have.
Yeah.
Yes.
Someone on social media, an area individual, posted 12 questions today.
Mm-hmm.
I think just to share it as representative of what some are thinking for your response. The first of the 12 was, the markets are decimated, our economy's in shambles, many local businesses will fail, and for what? Why are we willing to destroy our economy and way of life over a virus that has a 99.8% survival rate for those under 50?
Mm-hmm. So I know you've asked a similar question in the past. So the question really is, why are we responding in a way that is so significantly different? The perspective of some might be that this is a response that is not necessary and is impacting life too much, if I understand the question. Again, this is a disease that we have not seen in the past. We, again, have no vaccine for this disease. We have no natural immunity. It is not something that our bodies have experienced before, so we have some natural immunity to it. That does mean that when people are exposed, more people will get ill, and we know that already. We've seen that across the world. And people that are at risk, the rates of dying from that disease are high. The way we prevent a large number of people entering the healthcare system, needing the resources of that healthcare system because they are extremely ill, is that we do measures to prevent spread. Yesterday I spoke about making the circle small. We make that circle small of exposure so that not as many people end up overwhelming our healthcare resources. So they may feel extreme, and I think they are, frankly, extreme. We have not had things like this happen in the recent, in my lifetime for sure. But it's necessary because we all play a role in that spread. We've seen the overwhelming of the healthcare system in other parts of the world, and we need to prevent that here. Our goal in the end is to have resources available for the most sick, and we know there will be people that are significantly ill with this disease, even though many will get the disease and not be ill. There will be a significant population that will get sick and get very ill, and we need the resources to care for them. Despite having an awesome healthcare system in this community, it still has a limit on how much that it can withstand. And we also know that we are a healthcare resource for the region, so it's not just Eau Claire County residents that we need to care about. Yes?
This might be for any of you, but part of the governor's updated order is that bars can carry out alcohol if there's no local ordinance. I was curious if there's anything like that in place in the city or in the county that, or bars locally here could carry out alcohol.
Right, and I know, so the question is, the new order was more explicit about how the impact of the bar and restaurant order works, and that exemption was related to takeout food, and we know that that is in place, and there's some additional language of takeout for alcohol. And Dale, are you prepared to answer that? I know we're investigating that. The specifics in the city of Eau Claire and Eau Claire County may be different, and we can certainly get that information out, and we'll have that available on our website. Yes?
I'm a little bit, if you could clarify, the idea between, if you're in groups, no more than 10, and then also, as much as possible, stay at home. So let me just use like Alcoholics Anonymous. What would you say to AA folks who might typically turn out for a meeting over the weekend? So what's kind of the...
Sure. So the order is difficult. This is the order on mass gatherings. Again, the order has a lot of complexity to it. We encourage people to read it directly. I think fundamentally the intent of the order is to, and again, the question was related to how do we interpret this less than 10 people. The intent of the order is to make the gatherings as small as possible, especially in public settings. We know there are more than 10 people that work at the health department right now on this whole incident, and we need that. So there are many, many, many examples in our community where more than 10 people are gathering. In those locations, we are encouraging some distance between people, and we are encouraging all the normal and regular hand washing and all of those things that we do to make sure we're not spreading disease. For those situations that were explicitly asked about when there are meetings that are scheduled that are important to get together, there are lots of options with meeting electronically. We encourage organizations and individuals to find ways to do that. And again, reviewing the order, and if there are additional questions, calling our COVID line, and we are getting back to people quickly. Yes?
Do you believe community spread is present here in Eau Claire County?
So the question was, do we believe community spread is present here in Eau Claire County? The definition of community spread is where we don't know how someone, received the virus, the COVID-19 case, where that came from. And at this point in time with our 3 cases, although we're still investigating one, we are not under the assumption that we have community spread in Eau Claire County at this point. We are not one of the counties that's defined by the state at this point with community spread. Those identified counties are on the state website.
There's a lot of talk about flattening that curve. Is there any research that shows when we should start seeing things start flattening out, if this is even effective, or effective measures need to take place?
So the question is, there's a lot of talk about flattening the curve. How do we know when to use the different tools, and at what point will we start seeing that we can pull back on measures, or we have to have additional measures? So the governor and the state health department are looking at all the measures that they may need to use. They've clearly indicated today at the news conference that they don't expect additional measures at this point in time. They're counting on the public to really pay attention to the current mass gathering rule that came out today, which again we'll make sure is on our website, and doing everything they can to protect each other so that we don't have spread that's going to impact our healthcare system. That's the goal of the current orders. That's the goal of what we're doing in Eau Claire County as well. There is a lot of research with other diseases around flattening the curve, and so the question about do we have research on that? There is research. I think we're in an unprecedented time with this kind of disease, and I think we'll be learning a lot over the course of the next number of weeks and months. Yes?
I actually have a question for Chancellor Schmidt, if he's available.
Yep.
I'm curious about the college's recommendation asking students to leave the residence halls. How did you guys arrive at that decision? Do you think it is potentially dangerous for students leaving and going back to their respective hometowns? Can you talk a little bit about that?
So the question is around the request to see if students would leave their residence halls. First of all, we are not kicking students out of the residence halls. If they feel it's in their best interest to stay in Eau Claire, we will accommodate that. We want to be very clear on it. I had a lot of communication from students that it was stressful not knowing if they were coming back or not, and so part of the decision today was to let them know we would not be in face-to-face meetings, and therefore if students would choose to move out, we will prorate and provide them a financial savings if they are to leave the residence halls. We are letting people know that if they're going to stay, that we will eventually try to consolidate them to bring our costs down. The financial impact of us asking students to move out is a serious hit to the institution. So we're not doing it in our best interest. The decision was made based on what was in the student's best interest.
Okay, so can you talk just a little bit? It seems fortunate, I guess, that the students we were talking about earlier
Yes.
actually did not return to campus.
Right.
10,000 plus students. Can you just talk a little bit about how that played out and just, I guess, the sense that maybe we're lucky?
No, I think we were lucky. We have one of the largest study abroad programs in the country. I think we were ranked, I think it was 9th in the country for the percentage of our students, or the number of our students who spend at least a semester abroad. It's an important part of being a Blue Gold. And the number of messages I have from students who just have their hearts broken because they've always dreamed of studying in Spain, in Japan, England, Central or South America, and then being asked to come home. Students certainly understand the health risks, and we were very fortunate. We only have one student that we're aware of that's returned from study abroad that has been tested positive. I'm grateful that that student made the choice, and it would make sense if they were not feeling well that they would see their own medical professionals and return to their family for proper care. In all of these instances, so the one that was tested positive and the 2 that had studied with them and were checked, none of those came back to the campus, so there was not an opportunity to infect any of the rest of the campus or the community as well.
Was that just sort of happenstance and timing, or was that because they were tested elsewhere, this person already had it and it didn't come in?
You know, my sense is that that person was tested after they returned home. By the time they returned, they already knew the campus was moving to online, so there had been no reason to come back to campus. Any other questions for me while I'm up here? Okay.
And again, for any cases in any community in Wisconsin, the follow-up is very diligent, and any institution that would be involved would have that same follow-up to make sure that we were in touch with all the contacts of any individual case. Yeah.
I think California, New York, now Illinois, starting tomorrow, looks like they're going on more of a lockdown. So any sense from your standpoint on where we're at in that? Some are speculating about it.
Yeah, the question is, a number of states have announced recently, California I believe was the first, that they would start a lockdown process. That's dramatic language, but it really does mean everybody stays home except for the essential workers. We understand from the governor today at 1:30 that he directly responded to questions about that. It is not our understanding that that tool is being considered in the near future for Wisconsin, and we certainly are paying attention to that. There are a whole variety of tools we use in the toolbox to manage a big pandemic, and we are right now confident that the tools we're using will help limit spread. We also know that we will see likely more cases. What we're doing now is not probably going to eliminate the fact that there will be more cases in Wisconsin and in Eau Claire. But our goal right now is to limit the number of people that are severely impacted by disease. So with that, I think we'll conclude for today. Again, we'll be back on Monday at 3:30. We hope that this is a way that our community can stay updated and hear from a variety of people in the community that are working hard on this issue. And please check our website for additional updates. Thank you.